And we're back with another episode of On the Record with Tiffany and Kevin. And I'm here with two of my favorite people, the world renowned scientist and researcher, Dr. Donald Wesson, a nephrologist who has been in the trenches, both on the front line, serving patients, and also in the research field for the last 40 years, Dr. Wesson.
Absolutely.
Um, and we are just elated to have him. And then, of course, uh, the also world renowned Reginald Ballard. Come
Yay.
in and every other, you've been on so many shows. It's not even like I can't even count all the places that everybody you've seen and talked to. But I think the most important job that you've done for the world is your advocacy for kidney disease.
Absolutely.
Yeah. Trying to get it out there, because once you go through it, you know what it takes, you know what you're dealing with, and you be like, hey, man, I don't want nobody to have to deal with what I had to, deal with. So if you could stop one or two people from having to go through this and make them aware of, the seriousness of this disease, then, hey, I'm all right.
Well, I'd just like to add to what Tiffany said, Reginald. I mean, your witness is really important. I mean, just like scriptural, you can tell people what you read about what Jesus did, but then when you tell folks what Jesus did for you,
there you go.
That's an even more powerful witness. So your witness is really, really important. And I just commend you for having done it and done it for so long.
Thank you. Well, hey, we gotta guide them to you. Guide them to your direction.
Well,
let them know. So I have to go and do some blood work today. I was saying earlier, I have to do some stuff today because having a doctor's appointment next week. So last time my sugar was a little high, man. It was like around 9, 10. I got it down to like 7 now. So, I'm still trying to get it under 6, but
how did
almost there.
How did you get it down?
Just cut the sugar and the carbs. I cut that out, and funny thing about it, people think that, fruit. I was listening to one guy saying, eat a lot of fruit. It'll tackle your diabetes. And I always thought that you eat a lot of fruit, your sugar go up. But, when I eat the fruit, it don't go up like when I eat candy, I'm saying? Like, it's that kind of stuff. And the fruit really been neutralizing, my sugar. So now I have to cut way back on my insulin intake. I'll be like, wow, man, it's, yesterday my stuff ran low all day. It was like in the 60s and 50s. I had to like try to get it back up to like around 90, so it's been working out. But it's the little simple things. It's more simple than you think. It's the elimination of the breads, the pastas, the sugars is a real easy thing to do. But, in our mind, we've been eating that all our life and, feel like, we crave it because the more you eat it, the more you're going to crave it. But once you make a decision and say, okay, I'm just going to stop doing it and see how good you feel and how much energy that you have, you'll be surprised, man. You really be surprised.
Well, Reggie, I'm really glad to hear what you said about fruit. The fruit is a very good and a better substitute than sweets. So the fruits have what we call the complex sugars in them, which means that they are absorbed very slowly, whereas the candy has simple sugars in it. Right. It's absorbed very quickly.
Right.
So the candy gets your sugar up in your blood very quickly, whereas with fruit, it's very, very gradual and your body is able to handle it much better.
Right. That's what I found. I found that, and man, I'm telling you, when I do, if I, and it's crazy because I don't crave the sweets now that, as much as I used to. Now, like I can shoot, I have fruit in the house, and when I do crave it, I eat one in a minute and knocks it right out. So I'm like, cool, I can do this. I know how to, I really learn how to control everything. And then that make my kidney function better. That makes everything just work so much better, man, when you have things under control, instead of everything just all over the place. So hopefully this will be a life change for me now. So
absolutely.
This is my last year in my 60s. I mean, my 50s, my last year in my 50s. So 13th, I turned 59. And after that, the 60, man.
The 13th of this month?
13th of this month. I'll be 59 years old.
All right. Well, you're still a baby.
Yeah, I know, right? The doctor say still a baby. Boy, I went to see Cooley High in the theater. Oh yeah, but I feel good, man. I feel a lot better, man. A lot better. I can't wait. I used to be scared to go do my blood work, right? Because I knew it was gonna be bad. I can't wait to go now. I can't wait to go to get my blood work done now. I'm ready.
Because you know it's gonna be a good report.
It better be. It better be.
So, Dr. Wesson, can you tell us a little bit about your latest work? Because it's just been everywhere.
Well, thanks, Tiffany. So, as you mentioned, for decades, we've been looking at the benefits of healthy eating on kidney health. And much of that healthy eating is what Reginald was just talking about, more intake of fruits and vegetables. And so most of our work has been on folks whose kidney function at the beginning is less than normal. And we've been able to show that adding these fruits and vegetables improves the kidney health of individuals whose kidney function is less than normal. So for the first time, we've published studies just recently in folks who had kidney injury, as shown by high levels of albumin or protein in their urine, but their kidney function was normal. So this is the first time that we've published studies looking at the benefit of fruits and vegetables on folks with kidney disease, as evidenced by high albumin in their urine, but they have normal baseline kidney function. And we've been able to show that fruits and vegetables are also protective of kidney health in individuals who start off with normal kidney function. So for us, that tells us that a healthy eating that includes high amounts of fruits and vegetables is good for kidney health across the entire spectrum of individuals who have less than normal kidney function, but even those who have normal kidney function, with the goal of helping to keep normal kidney function stay normal rather than have it reduce with time.
So that particular issue transcends ethnicity.
Oh, absolutely. Yeah. The folks that we looked at were broad in terms of ethnicity.
And that's so important, because often we only discuss kidney disease in terms of through a lens of ethnicity, when the reality is 1 in 3 are affected by kidney disease. So we got to look at this in broader terms, like social determinants of health and the leading causes of kidney disease. So can you talk a little bit about how you expect this to affect the kidney world and how we're addressing it?
That's a very good question, Tiffany. So yes, it goes. It bears repeating that the kidney disease is disproportionately high in Black and brown communities. But that doesn't mean that it affects only Black and brown communities. It affects all communities. And one of the things that at least our group thinks contributes to that disproportionate high risk in Black and brown communities is the environment of those communities. And we think that the foods that these communities eat on a regular basis contribute to their increased risk developing chronic kidney disease. Well, you heard Reginald talk about the benefits of fruit. Well, our studies show in Black and brown communities there's very little fruit and vegetable intake because the access to those foods is restricted. When we started doing these studies almost 40 years ago in these communities, first in Lubbock, Texas, and now in Dallas, Texas, I was frankly surprised at not only the low level of fruit and vegetable intake in these communities, but their lack of access. The first community that we started doing this in, there was no grocery store there. And the closest one was 2 bus trips away. So one of the things that we continue to emphasize is the need to improve access to healthy eating in Black and brown under-resourced communities on a population basis. So Tiffany, in fact, I just gave a talk at a medical school yesterday, and the usual question that I get from physicians is, well, Dr. Wesson, yes, we like the science and you've been able to show the benefit of fruits and vegetables on kidney health, but you can't change the way people eat. And so we're not sure how practical this work is. So my response is, first of all, there are a lot of people like Reginald around who do actually change the way they eat when shown the benefit that comes from it. But the larger issue is one of making healthy eating available to entire populations. So that's the way our group thinks about it, not in terms of physician to patient. We think about this in terms of communities, making the healthy eating option available to communities where right now it is not available. So we think about this ultimately in terms of policy.
Yeah, because I know in a lot of Black neighborhoods, man, you got these dollar stores and they go get their fruit from there, man, and the next day their fruit look like your beard. You know what I'm saying? It turned to be buzz all on the fruit, So out here in California, man, we fortunate enough that we have farmers markets. So my wife goes to farmers markets on Sundays and get a lot of organic fruit and vegetables and stuff like that, And I'm telling you, if you did, like if you have kidney disease or diabetes, high blood pressure, you'll be surprised at how big a difference that your diet can make on you. I mean, it's the medicine that you take, it might be okay, but I'm telling you, when you do the fruit and vegetables and, the cut the junk food and a lot of the carbs and the pastas and all that stuff out, you will be surprised, man. I mean, it's like a miracle, and it's been right under our nose all along, but we've been trained. A lot of times, that's why I wanted to ask you too, Doc, far as fasting is concerned, like when you have kidney disease, you got to take a lot of medicine, and how can fasting, can you fast and take the medicine? Or would you have to eat on top of the medicine and you can't fast? That's the dilemma I'm having, because sometimes I want to just like go a whole day, just doing water, you know what I mean? So I don't know how healthy that is, beneficial, because I've tried it before. I felt real good, but I don't know if that's stressing the kidney because I'm taking the medicine with it. So it's like a dilemma I'm having right now with that.
So that's a good question, Reginald. So in general, there are medicines that work best on an empty stomach and some that work or don't irritate your stomach if you have food in your stomach when you take it. Mm-hmm. So generally, I tell patients to take their medicine with food. Mm-hmm. So the fasting may well be a way by which to help control your eating. Mm-hmm. But in general, I would encourage you to take the medicine at least with a little bit of food in your stomach. Don't take it on an empty stomach, because there are a lot of medications that can irritate the stomach.
What about like with the juice? What about like a juice?
Juice, yes.
Fruit,
yes.
Vegetables, you know what I mean? Yeah.
Juice works.
Okay.
Juice works. And in general, the study suggests that fasting is helpful. Mm-hmm. But if you just eat a small amount of food over the course of a day, mm-hmm. that's just as effective as fasting the entire day and then loading up on a bunch of calories the next day. You're actually better just eating a smaller amount of food over the course of the day constantly.
Gotcha. I know a lot of people probably was wondering that, so I threw that out there for them because I know I've been wondering about that myself. So,
well, and Reggie, I also like something else that you said in terms of your medication. The healthy eating goes well in concert with the medication. I know there are a lot of individuals that I hear say, okay, I'm going to eat healthy and stop taking my medicines. No. The healthy eating combined with the medication is a good combination. Now, your physician may well see that with healthy eating, you may require lower doses of those medications, but don't stop taking the medication in substitution for healthy eating unless directed by your physician.
Gotcha.
It's not all or nothing, right, Dr. Wesson?
That's correct.
When you do those things in combination, eat healthy and work with your physician on your medication, it's a winner.
Exactly.
It's a win for you.
Yes.
Working closely with your practitioner.
Yep.
And asking questions. And, when they see you adjusting your lifestyle to what they're asking you to do, man, the response is generally speaking, the response is a very good response because now you're engaging this person who has devoted their time to health.
Yes.
They're going to be engaged because you're doing and following that direction.
Absolutely. And Reginald, I really like what you said in terms of it being a lifestyle. So that's why our group does not use the word diet. We consider that as a 4-letter word because it suggests that you're going to do something for a short time and then stop.
Right.
But I like what you are emphasizing. It's a change in your lifestyle.
Yes.
And it's something that healthy eating becomes a part of you. The other engagement, healthy activities like physical activity and the like, that's also a part of it. So healthy eating, healthy moving, all works well.
Yes. I agree because I'm living witness right now because I've been eating junk food for a long time, man. I'm a junk food junkie. That's my vice, because I never had a drink, never smoked in my life. And but the junk food was my downfall. Now that I know that what it has done, man. I mean, I still can eat, when I still see food, I still eat. I know how to pick the stuff. Like I can still go to restaurants and stuff and I can eat without eating the pastas, without eating, the rice and the breads and all that kind of stuff, because you go to Papados and Cheesecake Factory and they give you all the bread up front. So you done already carved out before your food.
That's exactly right. That's exactly
you have
right.
blood sugar already high now and the food ain't even get there yet,
Yeah, and again, I have to applaud what you're saying, Reggie, because even at those restaurants, if you're careful, you can pick out foods that work.
Yes, you can, man. You can. And still be, I mean, you can still eat your salmon, your steaks and all that. And you just surround it with vegetables and you good. You get some grilled vegetables and some, all that kind of stuff instead of having the pasta on top of your chicken.
Correct. And one of the things that I encourage folks to do, rather than eating that bread that they'll bring out first, ask for a salad. Eat that salad first.
That's right.
Because that's healthy and filling.
That's right. And
then when the entree comes, then you eat less of that entree.
Yep. And that fiber is going to slow everything down. Especially if you're diabetic, it'll slow all that stuff down. So when you do eat, now you'll be surprised, man. Because after I eat, I'm like, okay, I used to look at my sugar on my phone. I'll be like, oh, okay, what's it going to be? And now I'll be looking at me like, man, it's still going down. So now I have to make an adjustment. I have to cut the insulin down. I'm taking, I was taking like 3-4 injections a day. Now I might just only have to take one and less. Instead of 10 units, I'm cutting it down to like 7, so it's like after a while, who knows? I might be totally off of the junk, you know what I'm saying? If I keep doing the right thing. So that's my goal right now. That's my goal.
Now, we've talked about lifestyle. Let's talk about early detection and a little bit about what you are, how important finding out early is.
It is the earlier, the better. The earlier the healthy interventions are instituted, like healthy eating, the better response that you'll get. And you heard me talk about indications of kidney injury through urine albumin excretion. That's something in recent years we've recognized, that the higher the amount of this protein in the urine, what we call the urine albumin excretion, the greater the risk for having kidney disease, and the greater the risk for established kidney disease for getting worse with time. So for a long time, we've emphasized dipstick measurements for sugar in urine to look for diabetes. We are now emphasizing dipstick measurements of albumin in the urine to look for evidence of kidney damage or the presence of kidney disease. And so that is really important. In Tiffany, the Texas Kidney Foundation has really made its name for this community-based screening. But I would add that physicians in their offices, particularly primary care physicians, make this more of a priority, particularly for individuals who already have diabetes and already have high blood pressure or hypertension, because those are the two major contributors to chronic kidney disease in the United States. So any individual who has diabetes and or high blood pressure or hypertension should have their urine screened for albumin at least once a year.
Well, I tell you what, I know you have to go, doctor, but in layman's term, I'm gonna break it down for Black people, did what you just said. He just said, if you go to the bathroom and pee and you come back the next day and you see little sugar black ants around your toilet, you need to go get checked. Because you might have sugar in your urine, all right? Yeah.
Mm-hmm.
That's the real
that's how they could tell that somebody had
that's right.
sugar. What's the very thing, what you're saying right there is that they, that was before had the technological advances we have now.
Mm-hmm.
Dr. Wesson, thank you for joining us this morning. I know you have another meeting, and we look forward to seeing you this weekend, where we're going to provide the first genetic testing for kidney disease.